In this video, we will be discussing the role of hormones in male sexual function. Refer to the endocrine system, as we will be discussing a couple of anterior pituitary gland hormones and their effect on the testes and the resulting downstream effects. We will also be discussing how negative feedback plays a role in the regulation of sexual function, so please refer back to the early chapters if a refresher is needed. Within the anterior pituitary, gonadotropic hormones, luteinizing hormone, and follicle-stimulating hormone are released. The main function of luteinizing hormone in the male is to induce the release of testosterone, while the main function of FSH is for the production and maturation of sperm. We will start with luteinizing hormone and its downstream effects. Upon stimulation of gonadotropic releasing hormone, luteinizing hormone is released from the anterior pituitary into the circulation, where it binds to receptors on interstitial cells of the testes. Interstitial cells are found adjacent to seminiferous tubules, where sperm production occurs. Once testosterone is released into the circulation, it has a few main effects, which include the maintenance of accessory glands and organs, creating and maintaining male secondary sex characteristics, which determine increased muscle mass, facial hair, and the amount of fat tissue within the body, increasing libido or sexual drive, and finally, stimulation of bone growth. Now, let us look at follicle-stimulating hormone and its effects on male sexual function. Similar to luteinizing hormone, the release of follicle-stimulating hormone is also conducted through gonadotropic releasing hormone, coming from the hypothalamus. FSH targets nerve cells within seminiferous tubules. When stimulated by FSH and in the presence of testosterone, nerve cells house the production and early maturation of sperm. Hormonal factors also play a role in the release of inhibin, which feeds back on the anterior pituitary to regulate the release of FSH. This is an example of negative feedback. Maintaining proper levels of gonadotropins is crucial in order to maintain normal levels of sperm, as well as testosterone within the body to prevent any undesired negative effects.